So good day, ma'am. I'm Joban Benedict F. Manisa from Samis University. So today I'm going to perform assessing the abdomen return demonstration. So assessment of the abdomen consists of inspection, auscultation, precaution, and palpation. The physical examination of the abdomen is the key step in the evaluation of abdominal complaints such as pain, distension, enlargement of organs or muscles. To conduct of the procedure, first thing to do is to review client's previous medical records if available. Next is to prepare the necessary equipment needed to conserve time and energy. The equipment that I'm going to use includes a tape measure for the measurement of the patient abdominal girth and sharp objects such as this ruler for the hypersensitivity test and the course of stethoscope to listen for. So and is to listen for patient's bowel sounds. Now perform hand hygiene to protect the patient and myself as well from infection and cross contamination. So good morning, sir. I'm Joe Benedict Manisa, your student nurse for today, and may I ask your name and your birth date for verification?
My name is Janice Cabañas. I am October 12, 2004.
Okay, thank you very much, sir. So today I'll be assessing your abdomen, which means I have to expose your abdomen, I have to listen to your vowel sounds, and also feel for your internal organs. Will that be alright? So that sounds good. Okay, so before we start, I encourage you to void first so it will be much more comfortable for you while doing while we're doing the assessment. So sir, pwede mang-isa ka, sir? Okay, so to ensure that the patient has emptied his bladder prior to the conduct of the procedure, because a full bladder can make the examination uncomfortable and it can reduce the accuracy of the bundle height measurement. So now, position the client in a supine position with arms folded over his chest or just flying at his side, and then place a pillow underneath the patient's head. So now, cover the upper and lower body parts of the patient, leaving only the abdomen exposed. So, sir, do you feel any pain in your abdomen?
No.
Okay, so I'll be inspecting your abdomen now. So, first I'll be observing the coloration of the skin. So, as I observe, sir, the skin may be paler than the general skin tone because this skin tone is so seldom exposed to the natural elements. Next, note the vascularity of the abdominal skin. So the scattered fine veins may be visible. Not any stretch marks. So there's no stretch mark in, as I observed. Yours are pink. The stretch marks are pink or blush in color or stray. Now inspect for scars. So as I inspect, there's no scars or redness or non-healing wounds. So assess for lesion and rashes. So as I observed, this abdomen is free of lesion or rashes and is flat or raised brown moles are normal. Now inspect the umbilicus. So as I inspect the umbilicus skin tones are similar to surrounding abdominal skin tones are even pinkish. So I inspect abdominal contour. Sitting at the client side, look across the abdomen at a level slightly higher than the client's abdomen. Inspect the area with the lower of ribs and the pubic. Okay, the Abdomen is flat, rounded, scaphoid, and evenly rounded. So next is assess the abdominal symmetry. So the abdomen is symmetric. Inspect the abdominal movement when the patient breathes. Okay, as the patient breathes, the abdominal respiratory movement may be seen, especially if my client is male. Then observe aortic pulsation. So as I observe, there's a slight pulsation of the abdominal aorta in the epigastrium. Then observe peristaltic waves. So normally, peristaltic waves are not seen. So next is I'm going to auscultate the abdomen. So warm the diaphragm of the stethoscope by rubbing it against your palm. Then place it beginning in the right lower quadrant and proceed clockwise, covering all the quadrants, and listen for at least 1 minute per quadrant. So as I auscultate the all quadrant, there's no hyperactive bowel sounds that I hear. So next. So next is note the intensity, pitch, and frequency of the sounds, and auscultate for vascular sounds. Over the abdominal aorta and over the renal iliac artery and over the femoral artery. So there's no browy that I heard in the aorta and the iliac and the femoral artery. And next is listen for venous hum. Using the bell of the stethoscope in the epigastric and umbilical area. So there's no venous hum that I heard. So next is auscultate the friction rub over the liver and spleen and listen over the right and left rib cage with the diaphragm on the stethoscope. So as I auscultate the liver and the spleen, there's no friction rub over the liver or spleen is present. So next is so now I'm gonna percuss. Percuss slightly and systematically all quadrants clockwise or up and down over the abdomen. As I percuss, the thin over the abdomen, dullness is heard over the liver and the spleen. So next is percuss the span or height of the liver by determining next B determining its lower and upper borders. So the technique is to assess the lower border, begin the right lower quadrant and the mid clavicle line, and percuss upward. Note the change from the tympani to dullness. Mark this point. So next is to assess the upper. So to assess the upper border, percuss over the upper right chest at the mid clavicle line and percuss downward. Note the change from the lung resonance to liver dullness. Mark this point. So the normal finding of this is the liver is located at the costal margin to 1 to 2 cm below, and the upper border of liver dullness is located at 5th and 7th intercostal spaces. So next is measure the distance between the two marks that I got. So I'm gonna measure the two marks. As I measure the two marks, the MCL is 7 to 11 centimeter. So next is to percuss the spleen. Begin posterior to the left mid axillary line and percuss downward, noting the change from lung resonance to splenic dullness. Ito na, so the spleen is an oval area of dullness approximately 17 meters wide near the 10th rib. So next is perform blunt percussion on the liver. So normally as I blunt percussion the liver, there's no tenderness is elicited. So next is perform blunt percussion on the kidney. So sir, pwede ka mo lingkod sa sir. Hanap. Then pwede ko gawin sa nila sir. Ay, buho po sir. So pwede sir. So I'm going to blunt percussion the kidney. So pwede na kami kabalik sir. So there's no tenderness or pain is elicited or reported. So palpation. Next is perform light palpation to identify areas of tenderness, and muscular resistance. Using the fingertips, begin palpation in a non-tender quadrant in a dipping motion, then gently lift the fingers and move to the next area. As I palpate, the abdomen is non-tender and soft. There is no guarding. Next is deeply palpate all quadrants to delineate abdominal organs and detect subtle masses. Wait, sir. Dire. Dire, sir. Dire. Sige. Ow. So there's no tenderness, and when I deeply palpate the old quadrant. So next is palpate for masses. Note their location, size, shape, and consistency pulsation. So there's no palpable masses are present. So next is palpate the umbilicus and surrounding areas for swelling, bulges, or masses. So as I palpate the umbilicus is surrounded by area are free of swelling, bulges, or masses. There's no subcenter of the umbilicus. And next is the palpate the aorta using your thumb and the first finger. Use the two hands and palpate deeply in the epigastrium, slightly to the left of the midline. Left of the midline. So as I palpate, the aorta is 2.5 to 3 cm wide with a moderately strong and regular pulse. So next is palpate the liver. Note the consistency and tenderness. To palpate the benually, stand on your right side and place your left hand under the client back at the level of the 11 and 12 ribs. Lay your right hand and parallel to the right costal margin. Ask the client to inhale, then compress down inward with your fingers. Isa go, sir. So, inhale, exhale. Inhale, exhale. So as I palpate the liver is usually not palpable, and it should be and it's smooth and even. So next is palpate the spleen and stand on the client right side. Reach over the abdomen with the left arm and place your hand under the posterior lower ribs. Pull up gently. Press your hand below your right hand below the left costal margin with the fingers pointing forward to the client's head. Okay. Inhale, exhale. So as I palpate the spleen is seldom palpable at the left costal margin. Next, the next is palpate the kidney. To palpate the right kidney, support the right posterior flank with your left hand and place your right hand in the right upper quadrant just below the costal margin at the MCL. So as I palpate the right and the left kidney, the kidney and the kidney are not usually not palpable, and if I palpate it should be firm, smooth, and rounded. So next is palpate the urinary bladder. So palpate for distant bladder. Begin at the symphysis pubis and move upward and upward to estimate the bladder borders. So an empty bladder is not palpable or nor tender. So next is assist the client to a comfortable position. So sir, pwede na kang tingkod sir. And next is do the hand hygiene. And document and referral for abnormal findings. So thank you sir for your cooperation for this assessment, and thank you kaya din. And that is all ma'am, thank you. Wala, ipasabi.